Welcome to the Deep Dive. We're here to give you that essential shortcut through complex topics. Today, we're tackling the really critical area of safety for older adults, pulling out the key points from recent geriatric nursing insights.
And this is so important. It's definitely not just theory. Think about this. Over 57,000 older adults die each year from unintentional injuries, based on data from a few years back, 2018, I think. Safety really is central to their care.
Wow, 57,000.
hmm
That's a staggering number of preventable deaths. So our goal today is to really understand the main causes you mentioned: falls, choking, poisonings, burns, car accidents, and figure out how we can help prevent them.
Exactly. And the research points to this kind of tension between two main types of risk factors. You've got the internal factors, things happening inside the person, like, normal aging changes, diseases they might have, medications, and then the external factors, hazards in their environment, stuff like poor lighting, slippery floors, even extreme temperatures.
Okay, before we get deep into those internal risks, maybe we should quickly touch on temperature safety. You mentioned it as an external hazard. When we talk about temperature, we're really talking about thermoregulation, right? The body's internal thermostat.
Precisely. And when that system doesn't work as well, which happens with age, you run into two big problems. On the cold side, there's hypothermia. That's defined as the core body temp dropping to 95 degrees Fahrenheit or even lower. And on the hot side, you have hyperthermia, which is basically overheating. If that gets severe, it can become heat stroke, a real emergency once the body hits 104 degrees or more. We'll definitely circle back to why older adults are more vulnerable to both.
Got it. Okay, let's unpack those internal risk factors now, starting with well, the natural process is getting older. Our senses, like vision and hearing, they're protective, right? And when they decline, injury risk definitely goes up.
Yeah, and it's interesting how they decline. It's not just things getting blurry. You see specific changes like diminishing peripheral vision, seeing things off to the side, and changes in depth of perception. Imagine trying to judge the height of a curb or maybe how fast a car is coming when your depth perception is off. That immediately makes falls and car accidents more likely.
And it makes everyday tasks potentially dangerous too, like reading the tiny print on a medicine bottle. If you can't clearly see the dosage, well, the risk of making a mistake, maybe taking too much or too little, it just skyrockets. Accidental poisoning is a real concern there.
Absolutely. And then add to that diminished hearing, maybe missing a smoke alarm or a car horn and a weaker sense of smell and taste. That makes it harder to detect spoiled food or maybe gas leaks or chemical fumes. It's like the body's built-in warning system is just not as reliable.
Okay, moving from sensory changes to more physical ones. What about the mechanical factors, things like mobility and strength?
Right, this is another huge contributor. You see a combination of things: decreased mobility overall, less flexibility, some loss of muscle strength, and importantly, slower reaction times. Gait changes too, how people walk, their sense of balance isn't as sharp, and even posture can shift.
And then when you layer chronic diseases onto those normal age-related changes, I imagine the risk multiplies.
It really does. Take cardiovascular conditions, for instance. Anything reducing oxygen flow to the brain can cause sudden vertigo, that's dizziness, or even syncope, which is fainting. We see this with things like anemia, heart rhythm problems, or orthostatic hypotension. That's the blood pressure drop when you stand up too quickly. It actually affects about 35% of older adults.
Wow, 35%. That connection between heart health and balance is really clear then. What about neurological conditions or problems with joints?
Well, conditions like Parkinson's disease or the effects of a stroke, they can cause significant weakness and major changes in gait and balance. And here's a really striking statistic. Older adults with diabetes have over a 65% chance of falling again after they've already fallen once. That's partly due to nerve damage affecting sensation in their feet. And then, of course, you have arthritis, limiting joint movement and flexibility, making it harder to catch yourself if you stumble.
Let's talk about medications. Polypharmacy using multiple drugs is common. How does that increase the risk of falls or other injuries?
It's a major factor. Basically, any drug that affects the central nervous system or blood pressure can be problematic. Think about sedatives, sleeping pills, tranquilizers, they slow reaction time, but also diuretics or blood pressure meds can cause that orthostatic hypotension we mentioned. And if someone also drinks alcohol, these effects are often amplified, creating a really dangerous situation.
And we can't ignore the mental side either. Cognitive issues or even emotional states like depression or just being really preoccupied. How does that play in?
It definitely reduces a person's ability to notice hazards around them. If your mind is elsewhere, if you're deeply sad or just distracted, you might not register that uneven pavement or that cord stretched across the floor. Your attention just isn't focused on potential dangers.
Okay, this all leads us to the biggest single risk factor, doesn't it? falls. The numbers are just, well, they're awful. About 1 in 4 older adults falls each year. That results in 3 million trips to the emergency department annually.
It's huge. Falls are the top cause of injury-related death for people over 65. And they cause most hip fractures. And here's a really sobering detail. About 1 in 5 older adults who break their hip will actually die within a year.
That is just crushing.
Yeah.
But the impact isn't always just the physical injuries of it. There's that fear factor, too.
Yeah.
Can you talk about how that fear of falling impacts people?
Yeah, it's a major psychological consequence. People become afraid of falling again, so they start limiting their activity. They go out less, move less. But that leads to becoming less fit, weaker, which ironically increases their actual risk of falling. It creates this downward spiral towards more dependence and isolation. That's why prevention is just so incredibly important. There are key initiatives focused on it.
Like what? What are the main prevention strategies?
Well, the CDC has the STEADI initiative that's stopping elderly accidents, deaths, and injuries. It promotes 3 simple steps for clinicians. Ask patients if they've fallen, feel unsteady, or worry about falling. Then, review their medications to reduce or switch high-risk ones. And finally, recommend vitamin D supplements for bone and muscle health. The Joint Commission also has its Speak Up campaign, focusing on patient awareness, using handrails, wearing non-slip shoes, making home adjustments, and crucially, encouraging people to ask for help.
When assessing someone's fall risk, what are the key intrinsic or person-specific factors that need to be documented?
You'd want to note any recent history of falls, definitely. Also, underlying medical conditions like heart failure, COPD, anemia, things that might affect strength or oxygenation. Cognitive impairment is a big one, whether they use assistive devices like canes or walkers, and even their footwear wearing flimsy slippers or backless shoes is a known risk.
And there are specific tests for this, right? You mentioned the timed up and go test earlier. How does that work?
It's a great functional test. Very simple. You time the person as they stand up from a standard chair, walk about 10 feet or 3 meters, turn around, walk back to the chair, and sit down again. If it takes them 12 seconds or longer, that's generally considered an indicator of increased fall risk. It tells you a lot about their mobility, balance, and speed.
So, if someone is identified as high risk, what are the key interventions, especially for making their home safer?
Good lighting is absolutely crucial, especially on stairs. Getting rid of hazards like throw rugs, they're a major tripping risk, and general clutter, electrical cords, things like that. Making sure they wear proper footwear like sturdy shoes with non-slip soles, even inside. Encouraging them to actually use their cane or walker if one's been recommended. And reinforcing that message about asking for help. It's not weakness, it's smart self-management.
You also mentioned exercise.
Yes, supervised exercise programs are really beneficial. Things that focus on balance, strength, endurance, flexibility. Tai Chi in particular has shown great results in reducing falls.
Okay, let's switch gears now to those external risk factors, things in the environment.
Yeah.
You mentioned fire risks earlier.
Right. Older adults are disproportionately affected by home fires. They're about 2.6 times more likely to die in one compared to the general population. While smoking materials are the leading cause of fire deaths, most fire injuries actually come from cooking accidents or issues with heating equipment.
So the safety advice here is pretty standard, but really vital.
Absolutely vital. Working smoke alarms and carbon monoxide alarms are non-negotiable. Check those batteries regularly. Extreme caution with anything involving flames. Never smoke in bed, especially not near oxygen tanks. Keep portable heaters at least 3 feet away from anything flammable. And having an escape plan, knowing 2 ways out, and remembering not to use elevators during a fire.
What about home security? Are older adults particularly vulnerable?
Unfortunately, yes, they can sometimes be seen as easier targets for burglary or scams. So basic security measures are important. Good locks on doors and windows, using peepholes or intercoms to check who's there before opening the door, asking for identification from service people. Having a system for daily contact with family or friends can also provide peace of mind and a safety check. And safe banking habits like varying routines, not carrying large amounts of cash, maybe using direct deposit.
And in today's world, we have to talk about online safety too, right? With more older adults using social media and the internet.
Definitely. Social media use among older adults jumped quite a bit, up to around 45% back in 2021. The key principles are similar to general safety. Be cautious. Use strong, unique passwords. Limit how much personal information you share publicly. Maybe wait until you're back from vacation to post photos. Be really suspicious of unsolicited links, email attachments, or offers that seem too good to be true, especially those asking for personal or financial info.
Okay, another sensitive topic. Driving, vehicular accidents.
Yes, this is tough. It's important to understand that while older drivers aren't necessarily a greater risk to others on the road, their own fatality rate in crashes is much higher, especially for those over 85. This is largely due to increased physical vulnerability. Injuries are just more likely to be severe or fatal. But age-related changes also play a role in causing accidents. Sometimes vision problems, slower reflexes, maybe hearing loss, or even early cognitive decline like in Alzheimer's.
What are the signs that might indicate it's time for someone to stop driving?
There are usually warning signs. Things like increased nervousness or lack of confidence while driving, difficulty staying in the lane or judging gaps in traffic, more frequent close calls or near misses, unexplained dents or scrapes on the car, maybe confusing the gas and brake pedals or getting lost on familiar routes. Those are all red flags.
And if someone does need to stop driving, what are the alternatives?
Right.
It can feel like a huge loss of independence.
It can be, but there are options. Family and friends helping out, community transport services, taxis, ride-sharing apps, and it helps to frame it practically sometimes. Pointing out the significant annual cost of owning and maintaining a car, often over $9,500 a year, can show how much budget might be available for alternative transport. That money can pay for a lot of rides.
That's a really practical point. Okay, let's do our final deep dive on external risks. Those thermal hazards we mentioned at the start, hypothermia and hyperthermia. Why exactly does the aging body struggle so much with thermoregulation, especially when it gets really cold, say below 60 degrees or really hot above 90?
Several reasons. Their ability to even perceive temperature changes can decrease. They often have less subcutaneous fat and muscle mass, which acts as insulation and helps generate heat. Circulation might be poorer, their metabolism might be slower. And importantly, the shivering response, which is the body's way of generating heat, often becomes less intense and effective. Certain diseases and medications can also interfere, things impacting the heart, endocrine system, hydration, or activity level.
Let's focus on hypothermia first, that core temp below 95 degrees. If the shivering response is weaker, what's often the first noticeable sign?
Often it's mental confusion or changes in cognition. They might seem lethargic, maybe disoriented. As it progresses, you'll see a slower pulse and breathing rate. Their skin feels cool or cold to the touch, maybe looks pale, and they can develop muscle stiffness. Intervention needs to be prompt. Get them into a warmer place, gently remove any cold or wet clothes, and cover them with warm blankets.
And you mentioned a crucial point earlier about rewarming. Avoid things like heating pads or hot baths.
Yes, that's critical. Rapid external rewarming can actually be dangerous. It can cause shifts in blood pressure and potentially strain the heart. It can also damage fragile older skin. The key is gentle, gradual warming.
Okay, now the flip side, hypothermia, when the body can't cool itself down effectively, high heat plus high humidity is a dangerous mix.
It really is. Older adults often sweat less effectively. Their thirst mechanism might be diminished, so they don't drink enough even when they're dehydrating, and they just have lower overall body water content to start with. Heat stroke with that core temp over 104 is a life-threatening medical emergency.
What are the warning signs leading up to heat stroke?
It might start with just feeling hot, weak, maybe listless, or experiencing muscle cramps. But the really serious signs include hot, dry skin without sweat. That's a key indicator the body's cooling system has failed. Also, a rapid heartbeat, tachycardia, maybe chest pain, and significant mental changes like confusion, agitation, or even loss of consciousness. And again, some medications like diuretics or certain drugs called anticholinergics can make it even harder for the body to cool down.
So prevention is key here too. What are the main strategies for avoiding hyperthermia, especially for someone living at home?
During hot weather, reduce activity, especially during the hottest parts of the day. Stay out of direct sun. Wear lightweight, light-colored, loose-fitting clothes, and crucially, drink plenty of fluids. Aim for 8 to 10 glasses of cool water or other non-caffeinated, non-alcoholic drinks daily. And they need to drink even if they don't feel thirsty. And just quickly, for hypothermia prevention at home, keep the thermostat set between 70 and 75 degrees Fahrenheit. Encourage staying active indoors, wearing layers of clothing, and eating smaller, warm meals throughout the day.
Great advice. Okay, let's wrap up by thinking about application, especially in institutional settings like hospitals or nursing homes. Based on the clinical judgment model, what are the key nursing actions for preventing injuries and falls?
It really starts with that individual assessment we talked about, knowing who is at risk and why. Monitoring vital signs, especially checking for orthostatic hypotension before someone gets up, have them sit on the edge of the bed for a moment first. making sure they use their assistive devices correctly. Answering call lights promptly is huge. Environmentally, things like using contrasting colors on the edges of steps can help with depth perception, ensuring sturdy handrails are available, keeping beds in the lowest position and locked, and making sure things like cleaning carts or medication carts aren't left unsecured where someone could trip or access them inappropriately.
That prompt response to call lights feels so important. If people wait too long, they might try to get up on their own, even when it's unsafe, right?
Exactly. Which brings us to the very careful use of protective devices, what used to be called restraints. The sources are really clear on this. There should absolutely be a last resort. There are strict criteria under regulations like OBRA. They must be used to treat a specific medical symptom, not for staff convenience or as discipline. It must be the least restrictive option possible. And there absolutely has to be a documented plan for trying to reduce or remove the device. Proper documentation is essential to avoid legal issues.
That ethical and legal component is critical.
Yeah.
Okay, finally, for older adults living in the community, what are the key home intervention takeaways?
Safe storage is a big one, keeping cleaning supplies, poisons, and medications locked away or well out of reach, definitely separate from food items. Discouraging risky behaviors like climbing on chairs or unstable step stools, encourage using proper reach extenders or asking for help, and really emphasizing the value of personal emergency response systems, those panic buttons or medical alert devices. They can be lifesavers if someone falls and can't get to a phone.
So, looking back at everything we've covered, this safety picture really highlights the complexity of aging, doesn't it?
It really does. You see this constant interplay between the internal changes, senses declining, balance shifting, chronic illnesses taking a toll, and the external world, which is full of potential hazards, from a simple rug to extreme weather. Managing that interplay is key to physical safety.
And we kept coming back to the psychological side, too. That fear of getting hurt can sometimes cause more functional decline than an actual injury, leading to isolation and dependence.
Which leads to maybe a final thought for you, our listeners, to consider. How does society as a whole need to adapt to better support the safety of older adults? It goes beyond just the nursing unit or the individual home. Think about car manufacturers designing more senior-friendly features, or city planners adjusting traffic light timings for pedestrians, or architects designing buildings with universal access principles. Real safety requires a much broader, collaborative approach.
That's a powerful perspective to end on. It really takes a village or perhaps a whole society to ensure safety across the lifespan. Thank you so much for walking us through this critical information today, and thank you all for joining us for this deep dive.